Wanted to know how do the parents recognize when it's a very young age, like 1-2 years, how do the parents recognize that that child may be having autism? To know how do the parents recognize when it's a very young age, like 1-2 years, how do the parents recognize that that child may be having autism? How is it for them? Wow.
So best indicator for them is the developmental milestones.
Okay.
So if there is a delay in the milestones, then they should become alert. They have to be very observant and aware that yes, my child is lagging behind. Now, many parents come and tell me, my father-in-law said my husband spoke very late. When he was 4 years old, that's when he spoke. So my child may also start speaking at 4 years of age or after that. But we need to be aware that there has to be stimulus for this child. There is no stimulus. See, speech is not a problem, but there is no stimulus, and that's why the child is not speaking. So, even there is a slight delay, it's always better that they consult an expert so that if they need some interventions, they can get it at the earliest.
So how do you find out if it is the stimulus is lacking, or is it really delayed speech?
See, if it is say, a child should be speaking at least 1 or 2 words by the time the child is 1 year old. If the child is not doing that at all, so that means there is a delay. So the child is 2 years old and the child is not speaking even a word. So that's when we say, okay, go consult a speech therapist. See if there is a problem. There could be a lot of problem with the mouth, if there is a physical problem, get it attended to. Or if there is a hearing problem also, then children don't talk. So we rule out, they should rule out all those things also. Yeah, if not, then the speech therapist help them with speech.
Thank you.
Yeah.
There is another question from Miss Shruti.
Hello, Dr. Subha. So
Hi.
my question is about the emotional therapy skills that are available. I mean, the skill therapy that is available. I'm not aware. I have a son with autism. He was diagnosed about a couple of years. He's been taking, speech, occupation, and other therapies, but he seems to be lagging behind in behavior and emotional skills. So those are things that are not easily addressed. So we just wanted to ask what kind of therapies are available for that.
So as I was telling, we have I have worked with this software. So we have launched this software now, and it is available with Rainbow Hospital. So wherein we are teaching the child how to acquire a simple emotion, like when you are sad, what should be your emotion? If you're happy, what is it? How do you smile? Two very, very complex emotions, like getting angry and those kinds of issues also we have addressed.
Okay.
So it is like we've just started our study, wherein we have attended to even the social and the emotional skills. And behavior tantrums are because we are not able to understand what they want to communicate.
Right.
Please understand you have to be very, very observant, very aware of their non-verbal cues. So if you can attend to that, most of their behavior tantrums reduce, and also look for their sensory sensitivity.
Right. And so in my, I mean, it's probably a different conversation, but in the main experiences that we are having right now are from the school, and when there are lots of kids around, it's transitions, and when there is noise or shouting or screaming, he's not able to handle that, for example. So what can be done to address that? I mean, how do we convey to the school that, this
Don't
part,
make
what you
noise.
said? Yes, exactly. So kids will make noise. So,
Yeah.
so things like this, how do we work around this? Or is it like exposure therapy?
See, that's where occupational therapy, wherein sensory integration actually works.
Okay.
So that's where you need to take your child for occupational therapy.
Okay.
Yeah.
One
Thank
question.
you.
One question from Mr. Natishan Ramaswamy. Thanks, Dr. Shubha. Very interesting topic. I have heard that kids with Asperger's syndrome can be cured with early interventions. Is that a fact or myth?
See, even they come out of the autism spectrum, but somewhere, like, it is a lifelong condition. So they come out of the diagnosis, but still they do have those features or the characteristics of autism in them.
One question from Ms. Shakuntala Devi Gandhi, please.
Namaste, ma'am.
Namaste.
Namaste. This is Shakuntala from Rajamandri Kanna Ashray Foundation. Actually, I got a doubt because this recognition and milestones, with those indications, we can recognize the children. Because I am handling with a son who is 35 years old. I am also running one organization named Kanna Ashray Foundation with 50 children along with my son. My doubt is I have already delayed while joining in the schools. How can we teach those children? Because before 18 years only, we can teach them, we can train them like anything. We will have some result with those people. But what about child like 35 years old, like my son? Because so many are asking and approaching me to join in our school above 35 years, above 45 years. Actually, I would like to handle them, because I would like to ask you, is there any way to teach them? I know this occupational therapy will definitely work out, but is there any way, or is there any treatment? Because day before yesterday we learned that artificial intelligence chips, and will it work with our children or not? I would like to know, ma'am.
See, you have said exactly that early intervention is the best.
Yes,
but say we have delayed, but some kind of an intervention is also important for these children. So now for this child, we need, for your child, where is the problem? If you are able to identify that and address that at any age. See, I do not know how to cook. As simple. So what is it that I have to do? Is I have to learn cooking. So similarly for them, what are the skills that they are lagging? It will take time, but they surely learn. And believe me, these children are not violent. They do not cause any harm to anybody. So generally they become aggressive. It's because we don't understand them. Please try and see what is it they're trying to convey. So, and see, I don't know if this artificial intelligence chips will work or not. I don't know, but what the program that we are coming up is teaching all these skills using a software. So
Yes.
any parent and a child together can learn how to do these skills. That's it. And parent need not run from one place to another. So all of the 4 or 5 kinds of therapies, they're available at one place.
Yes.
Yeah, that's it.
Thank you. Thank you for giving this.
Dr. Miss Shakuntala Devi Gandigaru, I would really like to thank you for running this organization in Rajahmundry, because as I've already shared, there are a lot of people across the country who have children or relatives going through this syndrome, and they have very limited support. It is the vision of Vishwa and Roshni that we would like to have such centers across Hyderabad too. And if there is anyone who's interested in starting such centers, we would like you all to get in touch with us so that we can look at how we can collaborate to provide these daycare centers for such people, so that parents can get at least a little relief for some time.
And Shakuntala ma'am, we would like to say by March or something, we would like to come and give you our product so that you can use it for your children.
Sure. Thank you so much. Thanks.
Mr. Mayank Sharma, please will you continue with your question?
Yeah, thanks a lot to Vishwa Talks for organizing this session, and thanks a lot, ma'am, for this very important information. I had a couple of questions. We have a kid who is now 3.5 years old. I think this got identified almost a year back. We have seen good improvement in terms of a lot of these sensory issues, but we have observed that sometimes these sensory issues come back, and that is also in line with how the child does occupational therapy. So there are times when he's not doing occupational therapy well, and that is when we see some of these issues coming back again. So is it fairly common? So that's my first question.
See, it has to be done systematically, consistently, and like the occupational therapist would tell you for how long these therapies have to last. And usually the areas that they have difficulty in, that's where the child will have problems. And in some way, to show the frustration, there could be behavior issues.
Okay, ma'am. So how do we tackle this? Because if we push him too much, then he throws tantrums, starts throwing objects and all, doesn't want to stay long at the therapy center, just wants to rush out. So is there a way to tackle this?
Maybe, we will have to you will have to combine it with behavior therapy also. Occupational therapy with behavior therapy will help.
Okay, ma'am. And sorry, one last thing, if I can ask, is that I think a lot of people recommend that, since therapy is only for maybe 1 or 2 hours in the day, so rest, obviously, the parents at home, I think they should try and replicate a lot of stuff which therapists do at the centers, right? Only thing is that in our case, our child, I think, maybe treats us too casually. So he doesn't do those things with us. Doesn't sit a long time for us. So while with therapists, he's still better. But with us, maybe just for a few, 2, 3, 4, 5 minutes he'll do, then he'll just go away. So how do we push the child to do that with us as well, which I think is very important for his development?
Yeah, first thing is decide who is the boss of the house, the child or you. Then, one more very, very, even though you feel that the child is not observing, please do not stop. You keep doing it. Even if the child just leaves, goes, but the child will keep observing, will keep noting. So once he knows that, this is the time, say 10 minutes, 15 minutes, decide on a time, stick on to that. So even if the child spends 5 minutes on the first day, by end of say 10-15 days, the child would be sitting with you for 15 minutes. So please do not think that the child is not observing or the child is just walking away. The child is aware that something is going on. The child usually comes back.
Right, exactly. So it's deliberately ignoring all this. So he's observing everything, but he's deliberately ignoring.
Yeah.
His
So
understanding is fairly good that way. Yeah.
yeah. So what happens is we think, abhi to kuch nahi ho raha hai, so just let me leave. So don't stop. You keep doing your part.